Hello, all you liberty lovers out there. My name is Graham Helsebeck, reporting for HeresyHerald.com. It's been a while since I've done a video, so I just wanted to clear up a few things about the Ebola outbreak because obviously that's big in the news lately. I think popular conception is, oh my God, either you're in the camp of Ebola is a big deal, it's going to kill a bunch of people, look out, or you're in the camp of please quit talking about this. It's not important. We live in America. Why are you concerned about poor Africans dying in the western coast of Africa, in these countries, Liberia, Sierra Leone, Nigeria, now Senegal, and even a few others as well, starting to get a few cases. But who cares about that? There are only 4,000 dead. CDC is predicting between 500,000 and 1.4 million by January in Africa. Other experts, a German expert came out and said 5 million will die. It's too late to stop the spread in Africa, and the only way to stop it is for the virus to, quote, burn itself out, close quote. And what that means is it'll just have to run its course. Basically, everyone will get it, and 5 million people will die, which is roughly the death ratio of this one. Roughly about 70%. The media is reporting 50%. That number is low because they don't take into account that new people. They don't take into account new people get the virus every single day. So they say, oh, this many people have it, this many people are dead. Well, it takes a while for people to get killed when they have the virus. Anyway, it's closer to 75%, and as anybody that's done the research knows, the death rate can go as high as 90%, especially with the Zaire strain, which is what this one is. Now, it is a big deal. When I first started doing my research on Ebola, on this outbreak in late July of 2014, yes, in July, I read some science journals, especially one that was reported on by the BBC in 2012, which is a Canadian study, university study that put pigs and monkeys in separate fences outside and tested Ebola to see if it could be passed between these two species. And it was passed between the monkeys and the pigs, who were separated by a wire fence. And they proved in that study that the Zaire strain can be passed from pigs to monkeys through the air to a limited extent. It doesn't necessarily mean that it's airborne per se, but it means that it's aerosolized, so particles can float around for a little while and survive in the air. Another animal can then breathe it, inhale the aerosolized particles that come out through sneezing, coughing, sweating, sweat dripping onto a kiosk at an airport that somebody later touches. So the thing about Ebola that's confusing, I think, right now is that people think the only way you can get it is through sexual contact, through needles, through contact with blood, sharing a drink, direct contact with bodily fluids, because that's what Obama says. That's what is in the CDC card, the supposed facts about Ebola. But it's not true. The Canadian, and read the report, read the BBC article about it. This all came out in 2012, and the BBC article was in 2012, and all this is out there. The Canadian Health Agency has said, quote, airborne transmission of Ebola is strongly suspected but not proven, close quote. Also, you have things like a secret military experiment in 1989 that I read about. There's also a Nova documentary, if you want to YouTube that. A Nova documentary that details the transmission of Ebola, the Zaire strain, same strain, through monkeys that were in a military installation. That 60 of the monkeys contracted Ebola, and then the other 300 or 400 monkeys were placed in separate rooms, and each and every single one of them got Ebola, contracted the disease, and they were in isolated rooms by themselves. So they, of course, contracted Ebola through the air duct system, through the ventilation system, proving, of course, again that Zaire strain was airborne. I think the most commonsensical argument, though, to make about why Ebola could be airborne is that American doctors who are basically, missionaries, and not spreading religion necessarily, but they're over there trying to do what they can with their expertise to help people that have contracted Ebola in West Africa, right? We've got dozens of American doctors. You've seen the pictures of them. Of course, they have the highest medical training in the world. These are experts. Most of them are venerable veteran doctors that have been, doing their jobs for decades. They've got the money they need. They want to go help people. And they're wearing level 4 suits. It basically looks like they're getting ready to plant a flag on the moon. Thick plastic wrap around their entire faces. P100 mask, respiratory masks, goggles, total face cover, and they're coming back to America with Ebola. How did they get Ebola if they had to go into sexual intercourse with the patient to get Ebola? I mean, it's just this insane logic. I think these American people in general, the general public, reads the newspaper and they read the fact sheet from CDC that Obama just put out last week, and it says you can only get Ebola through direct contact with bodily fluids, close quote. And then you don't think about, wait a second, how are these doctors going over there with these big hazmat suits on and coming back with Ebola? Dozens of them. So you just have to sit there and think about it. So I think I've heard the argument that this is just being hyped up by big pharma to make money. Well, I don't think that's true. I think that's a poor argument. It's fallacious because if you think about it, there is no known cure for Ebola. Really, the people that are recovering are the ones who get blood transfusions from the patients who have recovered and built up antibodies to it. So there's no known cure. I mean, there are a few treatments that are being developed by different companies that are being distributed now. The MAP company, one of my friends sent me a link to that, and indeed they have a treatment plan, but there is no known cure. Big Pharma doesn't have a vaccine for this, and even if they did, Big Pharma, big corporations in America do not care about poor people in Africa dying from this disease. They care about people who can pay them money. And you saw this disease has been spreading now for 3 months, almost a full 3 months in Africa. And for the first 2 months or so, there was almost no coverage. Maybe once a week you'd hear something. Now it is sort of exploding, but I don't think that's because Big Pharma has some kind of secret cure and they're trying to pump it up. First of all, I think it's being downplayed in the media. If anything, everybody's saying it's not airborne, it's not airborne. Don't look at these studies. It's not airborne. It's not airborne. And then, of course, if you actually read the medical literature, the university literature, you realize that there have been studies conducted by experts and scholars who have proven that it is airborne to a limited extent, especially the Zaire strain, which is the one actually being spread right now in West Africa. And of course, now we have patients in the United States, and we brought a bunch of them back and sent them to level 2 facilities, breaking all the protocols, breaking all the defaults. We got the border wide open. Brandon Darby from Breitbart proved that thousands of illegal immigrants have come through the southern border from Ebola countries. Something like 100 of them have actually been arrested. We don't know, they're fleeing their countries and they're making their way into South America and then making their way up into the United States through our southern border. So we got all the borders wide open, people coming in from Ebola countries. We're not even screening them, and we're not following any of the defaults. We've got the guy who actually contracted it and came into close contact with hundreds of people flying into Dulles Airport and then to Dallas, Eric Thomas Duncan. I mean, this guy was, he had his girlfriend with him and they were getting ready to get married, and he's running around with her around town because she's visiting the United States. Throws up quote, wildly on the pavement, on the sidewalk there by his apartment complex. And then later on, you see a local film crew coverage from the helicopter, and it shows these 2 or 3 people with a pressure washer with absolutely no protection, no mask, no protective outer garb, and they are pressure washing this Ebola vomit off of the sidewalk. And then the CDC didn't clean the ambulance for 3 days, didn't notify the paramedics that this guy was actually sick with Ebola for 3 days. So they had the paramedic, the chief paramedic, EMT, interviewed, and he said, "Oh, I didn't even know he had Ebola. I just knew he was sick and throwing up. I took him to the hospital, so he didn't know for 3 days." A very good chance that a bunch of these people will actually come out and say they have Ebola, because it's the 22-day incubation period. So you don't show any symptoms for up to 3 weeks. So, I think a lot of this is actually being downplayed. The information is out there, but it's kind of difficult to find. So I suggest you do your own research and take a look at my article from August 4th, Ebola Pandemic, One Glove Tearaway. That's heresyherald.com. And again, this article details what Dr. Eric Pianka said, but a bunch of Malthusian academics talking about how they want to get airborne Ebola released to kill 90% of the population because we're depleting the resources and we need to be killed in this mass culling event. So it's crazy to bring these people back and put them into medical university hospitals with level 2 protection when especially in Atlanta, when we've got a level 4 facility. All this information is detailed in the article. I won't continue any longer. I'm sorry for the length of this video, but just want to get the message out there. Please pay attention. Actually think about what's going on. Are these doctors with big hazmat suits getting sick because they're going around drinking after the Ebola patients they're caring for? Or is it airborne to some extent? Aerosolized in particles that are being sneezed down and coughed out. Think about it for, just sit there and think about that for a minute. Well, that's all for tonight. I want to say farewell and thank you from Graham Hasselbeck, heresyherald.com.